Sam did his fellowship in New York, where I was doing my residency.
Is that where you met?
So that's where we met. But you're originally from Dallas.
Yes.
And then you went to Princeton for college.
Right.
What year did you graduate?
91.
Then you went back to Baylor for medical school.
I did. I did Columbia for residency, and then I did the fellowship with Ed up in Albany with you. Yeah.
Mm-hmm. Sam has been so prolific in writing tons of articles. I mean, I saw over 250 articles, but
you are the hair guru.
Well, on everything, not just hair, but facial plastics in general, but also just his incredible books that he's written. And you can't see this, Sam, but
we have a stack.
I have a stack right here. This is like an encyclopedia for hair transplant. And you can see I have marks, I have sticky notes, and I refer back to it all the time.
I write for surgeons. It's a cookbook for surgeons. I'm always thinking to how can I have a better expository style that a surgeon can actually digest very easily,
Mm-hmm. Well, I think I'm an English major, and I think certain people have a gift for, part of it is the organizational process of it, to look at it and break it down in such a way that people can understand it. And not everyone can do that. That's a gift to be able to do that. So
I'm a big fan of Sam Lamb's work. And he also teaches a big course in St. Louis. Is that still going on? I've been to it twice and I've loved it. Even though it's got very basic lectures, it's got advanced lectures as well. And just, just really good review, and it's close to home. So I've always really enjoyed that. And then what we're getting excited for is the fall meeting, which we can get into.
Or the Berlin? Are you?
Well, I'm talking about Berlin, but
yes, you're talking about Berlin.
I'm talking about Berlin.
You got it. Berlin is. I just got a $12,000 sponsorship this morning for this incredible. I'm throwing out all the cool stuff that is just like not just the program, which is insane. It truly will blow your mind. Every minute will blow your mind, and then the fun events I've got thrown in there. I can't even tell you about them. They're just going to be absolutely stunning, and branded stuff you're going to take home that you will want to wear and keep, not like these ugly bags.
They're ugly. Yeah.
I designed the hat. I designed the bags. I designed the entire gala experience. It will be really unique. Everything.
Sam really is a Renaissance man. So
he really is.
Time on the design he did. Yeah.
He does all of it, man. You're kind of an artist, it sounds like.
I paint every day. Yeah. I paint portraits. I paint.
You do really?
Yeah. My paintings have sold for top dollar, 47,000, 57,000. Yeah. Yeah.
Wow.
I know. He's an interesting guy. It was great spending time with him for that year in New York. What I really wanted to start with is the drastic change that hair transplantation took, I would say, in the late 90s and early 2000s, where hair transplants were being done, but it was not yet a craft that people studied and really worked on to try to get really beautiful results.
The results
they weren't really result driven. The result was the hair was transplanted.
So a quick history of hair transplant in a nutshell, the major turning points. The 70s were the plugs, the large, 4-millimeter plugs. And then those were dissected into quarter and half grafts called mini and micrografts in the 1980s. It wasn't until 89 with Bobby Limmer from San Antonio that used stereo microscopic evaluation with a strip procedure that came to light and really became more modern. In the 90s, a big popular thing was scalp surgeries that have fallen out of favor simply because they really don't, they left a lot of scars, and it's really hard prediction over time when hair loss progresses. It starts to look a little weird.
And that's moving hair.
What's a scalp surgery?
Like Sylvester Stallone most likely has had a Uri flap. Same with Donald Trump. These are basically flaps that have been elevated and placed into the front. That's why Donald Trump's got to wear his hair down. That's why Sylvester Stallone, you can actually see the scars if you look carefully. They're still in Hollywood, shockingly, but these are flaps or extensions, flap scalp lifts, things like that.
Okay.
And then it wasn't until early 2000s with Bob Bernstein and Bill Rassman in 2002 that really started to understand FUE. They took it from this guy Ray Woods out of Australia in the mid 90s to go back to that punch that was popular in the 70s. Instead of taking one that was 4 millimeters, now they're taking ones that are 0.8 to 0.9 millimeters. And what then that evolved, the biggest evolution in 2016-17 were two men, Trivellini and Devois, who came up with really just a revolution, because before then the FUE punches were either sharp or dull, and that caused a lot of mangulation of the grafts. What they did was several things. They created a hybrid punch, which allowed a soft frontal face that did not cause trauma to the graft. Picture a trumpet, and a sharp flute that could cut the surrounding tissues without damaging the graft. And instead of a high-speed rotary, it was actually oscillating down, so they didn't cause the thermal injury and the torsional injury to the grafts. So that's a quick history of where we are. And it's really craftsmanship beyond the technology. The quality is how good your staff is and how good you are, and your artistic eye and understanding hair loss patterns. If you design patterns that look weird, it doesn't look right, And I think one of the biggest trends in the industry right now, which is going to be it's going to be a big backlash within 5 years, is, you probably know, in Turkey, basically there are no physicians, there's no sterility. I just had a guy I saw 2 days ago. They want to do a crown transplant at him at 26 years of age, locally, actually, not, and he should never get a transplant in the crown. It would be very dangerous due to the fact that that's going to expand. He will not have enough grafts with no medical protection. So just absolutely unethical.
Okay, let's get into that just a little bit more. What Sam is talking about is the hair loss progression in men. Yes. And if you take a younger man with early loss and you transplant hair into that area, then if they lose the rest of their hair, right, then they're stuck with a very odd pattern that doesn't happen in nature. And it's especially more troubling if you do it in younger patients.
So let me ask you just to kind of backtrack a little bit, because I feel like you're getting ready to jump onto the treatments. Mm-hmm. It seems like the men and women, it's a little bit different. So let's start with the men. Totally. Okay, so with the men, right? What is their hair loss like progression, okay, and treatment? Like, what does that look like in a nutshell?
So in a nutshell here's the issue: supply and demand. Not like economics, but the supply continues to dwindle. What does supply mean? Hair that's usable to transplant. These hairs genetically are programmed not for loss, and you can move them up here and be retained. The problem is, why does supply diminish over time? One, if your crown expands, that supply that you thought was great in your 20s actually is much smaller. Think of a horseshoe of a guy really bald. That hair that you thought was safe actually is unsafe. It's going to be lost. And then every time I take a transplant, I'm also taking supply. So I'm taking more and more.
Also possibly would see a scar. Mm-hmm.
Yes, it's not scarless. That's the lie. People think, well, I can just shave my head if I don't like it. No, you can't. You're either going to have dots from an FUE or a strip. And then the other thing is increasing demand. You get balder and balder and balder. And where the real risk sits in the crown, the back of the head, where the swirl is. And the reason is, if you remember high school math, pi r squared, when the radius doubles, it's 4 times the surface area. And that's why this 26-year-old that's trying to get a transplant in the crown with no medical therapy to protect against loss is in for a severe problem over time that cannot be fixed. So you don't want the supply curve ever to touch demand curve. And you as a surgeon have to have the ethics and the judgment to think in 10 to 20 years, will you have enough future dwindling supply to fix future increasing demand where those lines can never intersect? Mm-hmm. And then medical therapy in a nutshell, you need finasteride minoxidil or dutasteride minoxidil, which are basically blocking what's called DHT, because men have testosterone. In the old days when there was eunuchs and there was castration, there was no more hair loss. But men with testosterone, they're driving persistent hair loss. So you need to control it with a blocker, a DHT blocker. And so those are the easiest way to understand male hair loss management.
And are you doing oral for both of those?
I've moved toward oral, and the reason is I started with oral finasteride, topical minoxidil, which is the classic Rogaine and Propecia. I moved over to topical because men were afraid of sexual side effects, persistent sexual side effects. But having been in practice now close to a quarter century, I see these men that were on it, they stopped because they got lazy. It's tough to do something topical. Mm-hmm. So I'm gone back to the orals because now oral minoxidil has become really in vogue. And now I'm doing even more dutasteride, especially in young men, because dutasteride blocks about 99% of circulating DHT versus finasteride or Propecia that blocks about 69%. So I really want to get a grasp of blocking DHT for the young guy. Now, if you're 65 years old, you've got plenty of donor hair, I may not even put you on medical therapy. The easiest way to think about it in a big picture is young men, medical therapy all day long, really be careful with surgery. Middle-aged men, surgery plus medicine. Older men, I may just do surgery and not even do the medicine. So with women, I'm opposed to medical therapy in the classic sense. I rarely put women on finasteride minoxidil. I do natural therapies. Now, why do I do that? One is that I find them not to be that effective in women. I find they have too many side effects in women more than men, like hair growth. Oral minoxidil has a 15% of chance of hair growth.
Yeah, no, I feel like it's closer to like 30%, honestly. We start growing our hair in perimenopause on our other parts of our body anyway, even if we're not on medication. And then you throw oral minoxidil on that, and it's very troubling for people.
Yeah.
And then the spironolactone, I haven't really seen that much improvement at the doses that people are on. And if they up the dose, they start becoming really symptomatic. So I see a lot of women coming in on 2 blood pressure medications to try to help their hair. And I'm not really sure that's the best take. So I'm really interested to hear on how you proceed.
If I'm going to tell you all my natural therapies, there are a lot of brands I'm going to mention. I don't know if that's kosher or not.
Go for it. Knock your socks off.
So one brand I really love. Why? Because I invented it. It's called FolliFlow. It's been out for about 4 years now. I worked on this development with a Harvard MD, PhD, also hair surgeon. And we just finished a double-blind prospective randomized placebo-controlled 2-arm study, which in plain English means real science. We looked at acute telogen effluvium, which in plain English means shedding and shock loss. We looked at a phototrichogram, which means a not unbiased evaluation of the hair follicles. And this really, we showed within 1 month p-values, which means real science, statistically significant, less than 0.05, 0.01, by 3 months, less than 0.001, statistically significant growth, stabilization of shedding, phenomenal. And it's a shampoo, conditioner, and spray. Of course, as I just mentioned, I have a disclosure because I came up with it. You get on Amazon. FolliFlow.
What's it called?
FolliFlow. You can look at folliflow.com, FOLLIFLO.com.
This is just for females, though, correct?
No, it's for men and women. But as I said, for men, they've got such a testosterone problem that FolliFlow for me, I use it for men as a bonus, but not as a core therapy. Mm-hmm. And I also use it around the time of surgery, especially for women, because they can shed. And this really shuts down the shedding. I hit the donor and I do the front for a few weeks before and a few months afterwards. And it really shuts down the risk.
So when you transplant in a woman, the adjacent hair that's there can sometimes go into a shock phase. And so this stabilizes the hair that's there.
Okay. Thank you for clarifying that. That's exactly right. So that to me is one of my core products I work with. Another one that I've only recently started to see how amazing it is called ISHRS. I don't have a financial affiliation except I give these to my patients. It really is 2 gummies instead of like 4 horse pills with Nutrafol. I've seen better results with it. Sometimes as short as 1 or 2 months as well. I think there's stabilization with nutritional issues and women just get a really good benefit from this. Guys do too. And then another one, which is called Hair Stem, which is something that is basically, there are bioidentical plant-based growth factors. And if you think about growth factors, you think about bioidentical hormones in women in going through menopause. This is just basically growth factors placed through the scalp, sort of like PRP, but without the needles. I have not found other therapies to be that effective, exosomes, et cetera. PRP is very uncomfortable. People just don't want to keep on doing it. And so these are sort of my trifecta of therapies. I have invented something that I'm patenting right now. I cannot actually tell you everything, but I've got a technique with some Botox that I can actually stimulate hair growth. But you'll hear about it in about a year from now. So I'll give you a tease on that, but I'm not going to tell you more about it. But those are my strategies for women. Now, if they're postmenopausal and they're on testosterone replacement. So men with testosterone, I tell them get off testosterone because if they have a sensitivity and hair loss can be a problem. But a lot of women in their postmenopausal setting, they also have testosterone imbalance where they need it for sex drive, other things. And then I start seeing them lose hair. In those cases, I oftentimes will add a finasteride orally to them, which is a DHT blocker I mentioned for men. But that's about the only time I usually use it in women is in that setting.
But surgery, like women don't get hair transplants.
All day long. So this is the debate I had with my very esteemed colleague in Saudi Arabia. Now, he did an amazing study. He looked at 1,000 women. So that's a pretty huge study where he looked at the miniaturization of hairs in the donor. So what that means is that when hairs in the back are thinning, miniaturizing, those hairs there's an expression called diffuse unpatterned alopecia or DUPA. That means those hairs should not be transplanted to the front because they won't survive over time, they'll be lost. So he looked at 1,000 women and found a high incidence of DUPA. So he puts women on finasteride minoxidil, and unlike me, for the reasons I've enumerated, and he doesn't do transplants of women because he finds the success to be very marginal, risky. And I find the exact opposite. So I find that if the miniaturization level is below 20%, I get very sustainable results. And the reason is that women who have the miniaturization in the donor, they don't go to baldness. And that's the first thing. So I transplant a lot of women. About 30% of my practice is transplanting women. So much higher than most people's percentages. Also, you have to understand, without getting to every type of transplant for women, you have to understand a strategy for design. First, women are not going to shave their head. Second of all, they're not going to go totally bald. Third of all, they want a strategy to look better. So what I've devised is a strategy called T's, L's, and reverse L's. So essentially what that means is if woman says, I want hair everywhere here, I say, look, it ain't going to happen. Most likely it's not going to happen. Sometimes in about 10%, I have enough to do that. So we have to strategize. The central forelock right here is a critical zone. It's in the front zone. The hair part is critical. So a T is a central hair part with that forelock hit. And L is a part on the one side and reverse L is a part on the other side. So that is my first goal, is to hit that. A second round, I could do more. It's strategy. It's a strategy. She said, well, I don't want to part my hair only to the left. Well, I'm sorry. To do a transplant, because women's donor usually is not as robust as men, but they don't go as bald, it's strategy.
So it really is we always talk about how important it is to choose your surgeon wisely. This is that times 80. I mean, if you're especially being a female, you're going to want somebody that knows what they're doing with the T's and the L's and all the different things that could go wrong. I mean,
I do feel like a lot of women spend a lot of time on the medical side of things, between their dermatologists and their primary trying to offer them something. And I don't know that it's really always helping very much.
Totally
I think people
agree.
get frustrated.
Totally agree. And here's what's so funny. Even though if I have a young guy coming into me with for a transplant, I'm very, very scared, as I said, in many cases, with a few caveats. But with a woman, let's say they're 35 and they're telling me they have a 10-year history of thinning, either PCOS, polycystic ovary syndrome, or some other reason they're thinning over a 10-year. I'm ready to do a transplant like this. And the reason is that I know they're not going to go bald. They're not going to worry about a scar in the back because they're not going to see it if it's done well, and they need hair. So the way that I sort of divide women into who's a surgical candidate, minus weird conditions like scarring, hair losses, things like that, which I don't want to get into, but we can. But just traditional female pattern alopecia, hair loss. If they're rapidly shedding and thinning, okay, well, no, they need to be on medical therapy using the natural therapies. If they have chronic thinning, then for me, I have a very low threshold to say, let's transplant, let's do it, and maybe put on some medical therapy to slow down the loss. But that's my philosophy.
I'd also like to add that just hair loss in women can be so mentally difficult for them. And men can get away, it's more socially acceptable. But for women, it's just really, really hard emotionally. And so they may be willing to be accepting of procedures, downtime, this or that, to get to the goal that they're looking for.
And they'll be more likely to follow the shampoo that we won't get lazy with that. It's
That's true.
important.
Women,
You know what I mean?
I do a lot of eyebrow transplants in women because they have to clip their hair twice a week, to keep it there. And men, if they're heterosexual, straight male, I go, I'm not doing you.
Yeah.
You're gonna have eyebrows down to here because you won't deal with it.
Yeah,
But honestly, the regimen is pretty simple for women, even on the medical therapy side, the way that I've created this. But for me, it's psychologically devastating for men as well to have hair loss. The only difference is oftentimes they can shave their head and be done with it. With women, they don't have that option. And so with women, the great news is they don't necessarily, obviously they're never going to shave their head, but I can give them an ability to do it without needing a wig in many cases.
I guess I was surprised, and I don't know a lot about this, so I was trying to educate myself a little bit, but I didn't realize is the downtime, the recovery from a hair transplant.
Super fast.
Okay, so can you take me briefly through that?
So it's really fast. And, Hannah just interviewed me about my technique that I invented for Botox for pain. So if you use this Abasi formulation, which is basically a dilute steroid injection to the recipient area, that's this area here, 95 to 98% of my patients do not have swelling now at all. But now around the eyes, if I'm doing an eyebrow transplant, they'll have some swelling around their eyes that looks deforming for a few days, but not with a normal transplant. So swelling is not part of the equation. I have a Joint Commission accredited facility, which means I can actually sedate my patients so they don't feel any pain during the procedure. Afterwards, if you use a lot of what's called tumescence, which is protective fluid away from the nerve and blood supply, then they should have almost no pain. But by my using this dilute Botox in the meridian channels back here, a few points, they have immediate correction of pain. So there should not be pain. So if you're worried about pain, if you're worried about swelling, that usually is not the equation. I don't shave women's heads, so there's no shaving. I only shave a centimeter from the back. I do a strip procedure exclusively in women. I don't do FUE, so there's no shaving. And then in the areas that I transplant, if they have a naked front zone, then they'll have little scabs there that'll be visible for a week. And you can wear a hat the moment you leave my office, or you can wear a scarf pretty much the moment you leave my office. So a lot of women, or they can style it down. If they can do that for a week, they'll have little scabs. They after a week, the scabs are rubbed away. They're back toward invisible. So it's a week of hat part, to cover it. Otherwise, they shouldn't have much time off. You can exercise within a week. For me, I have my patients shower within 24 hours. You can travel within 24 hours. My only thing is, as Hannah alluded to, is the biggest risk with women is temporary telogen fluvium or shock loss or shedding. And that's where I pull my FoliFlow in to really mitigate and minimize that risk.
How soon do you start that before your transplant?
Ideally, it's 3 months before. My only reason I don't do 3 months before is first, people are, sometimes they just forget to, they don't want to do it for that long. But the other reason is I actually don't want to grow hair. So if I grow 20% of hair growth and then I'm thinking, oh, this is great, but that's really actually unstable hair that over time could be lost, then I transplant and then they stop the FoliFlow, they lose that 20% is not good. So I usually do about a month to 6 weeks for maybe 5% hair growth, but enough stability. And then I carry it afterwards for a longer period of time just to make sure it's stable for, another 6 weeks or so afterwards.
Yeah. And one thing that I'd love to get into a little bit, it's my more recent love, is the eyebrow transplants.
I didn't even know you could
really love them. And it's really been hard for me to get the word out about it.
Yeah.
But so many patients are, come in with these tattoos and they're really unnatural
so bad.
looking. And even if you just have some hair there with the tattoo, it's so much more natural and beautiful than not having anything. And people just don't know about it. And I agree that, I just want to emphasize the point that the strip is not, it's not bad or worse than the FUE. It's just done in different circumstances. The only time sometimes I'll do FUE where that is if I'm trying to, I feel like their hair is too thick for the eyebrow and I'm going to get thinner hair. But it's just a really, really beautiful procedure. And I'm just hoping more and more people go that route.
Well, can you tell us about the procedure? Because I don't know anyone that's had one. And I feel like I'm a good test patient because I look into all this stuff.
So eyebrows are great because, back in the 80s and 90s, people overplucked their eyes, and now the trend is for more of a natural look that's fuller. Eyebrows are, I always tell my students at St. Louis, because my St. Louis course is really a beginner's course to an intermediate. So do not do eyebrows. Eyebrows are the single hardest thing to do well because you have to make the angles absolutely perfectly flat, and they have to be designed in a way that's very unforgiving. It's in the middle of your head versus, I'm sorry,
Outlines your face.
versus in the back of your head. So eyebrows are the most sophisticated thing to do well, technically. And then placing into that is incredibly hard because they're so tight and so fine that if you don't have good placers doing it, you will have really mangled bad results. But Hannah's obviously getting amazing results because she's qualified, her staff is qualified, and that is really what makes a big difference. Actually, my Instagram right now, I have a 23 section posts about eyebrows alone. So the eyebrows require that. The other thing with eyebrows, as I mentioned, the main thing is you need to know you got to trim them a couple times a week because they will grow like your scalp hair. I'm not convinced they will slow down. Sometimes they can. There are a couple pearls with eyebrow transplants. Besides picking a good surgeon, is there are really nice little shears you can get on Amazon that are blunt and short, and they look like what a hairstylist uses to thin down hair, so that it doesn't look like it's chopped off, and it makes the trimming of the eyebrows really easy to do. And the second thing is, despite going to the best surgeon in the world, sometimes 2 or 3 hairs don't lie flat, and so using a eyebrow wax, you can use mustache wax too, but they're actually eyebrow wax.
No, there's great. They have their ones.
Yes, and you can use it to train the hair down. So long as the angles are not totally off, if they're just slightly off, they don't grow quite well, that will train the eyebrow to grow in the right direction. So those are 2 small pearls.
Yeah, I have to use that because I have a little cowlick like on my eyebrow. So I have to, and they really do have good ones. They have clear ones. They have ones that are colored. So
do you use any lamination for your eyebrows afterwards?
What's lamination?
Yeah, I don't even know what lamination is.
It's like a perm that lays the hair flat. And
perm is more, I'm unfamiliar with that.
Of course, it has to be done every 6 weeks or so, but it also helps, I think, kind of train because the hair doesn't have the kinks in them at that time that they're healing.
There will be a poster on lamination for Berlin, the meeting I'm running this year, but I couldn't accept it as an oral presentation. there's not enough podium time.
Yeah, it's just something that I'm playing around with, trying to help patients afterwards. In my ideal world, I would, I always tell patients that the density might not be there after the first one when we can plan for a second one. Yeah. And at that time, if there's any misplaced hairs that seem not at the right angles, we take those out.
Is there downtime after you get that done?
There's downtime. I have swelling on my patients afterwards, and I tell people about a week just to be safe. But
yeah, I get swelling with eyebrows. I can get a little even mild bruising because it's just in a very vascular area.
Mm-hmm.
Mm-hmm. Yeah. So hopefully we get the word out.
I know.
Those tattoos are.
The tattoos are terrible.
Passe, and
the other trick too is what I tell my patients: if you like your tattoo position, you just don't like how ugly it looks, don't remove it because the eyebrows look denser over a tattoo.
That's what yes, I couldn't agree more. I just think it looks so much more natural just to have even half the normal density over the tattoo than nothing at all.
Okay, well, I know one thing we wanted to talk to you about is that, it's so interesting that you say you paint. It does not surprise us. One of the things Hannah and I were discussing is, this is not, like I said, I think all plastic surgeons have that special gift of being an artist, but a hairline, the things that you gravitated towards, the things that you specialize in, do the most. I mean, can you tell us a little bit about that?
About my art or about
Yes, well, about your art and your practice. I mean, how those thread together.
So art is my passion. I have to, I live, breathe, and eat and sleep it. If I'm not painting, I'm going to a museum or learning about art history, whatever it may be. I've done all the logos here. You can see I design, or over here, logo designs for my building. I've helped design my building. I've designed the interior, helped design the interior for my home. I'm just an artist and designer. I paint for charity causes. I paint for my decoration for my office. It's just a worldview, a way to see life. I love beautiful design. I would probably be either a industrial designer or I would have been a clothing designer. I just see color, light, art, shape, everything in my life. Everything I see is in those terms. I have to paint every day. It's really important. At work, is like art. I love doing noses or doing hairlines because I think through how it's going to look for that person aesthetically, and if it follows all the rules of naturalness. So I love art. It infuses all parts of my life.
It's really cool.
Yeah, I mean, I think everybody has to have outside hobbies, but now that you have a family, and I see that on Instagram,
Yes.
maybe you have less time for some of that.
I'm just I'm very regimented. So I get up at 5 a.m. I work out. So I used to go to the gym. Now I have my own gym at my home because I don't have time to go out to the gym. So right next to my bedroom, I work out at 5:30 to 6. And from 6 to 6:30, I paint, unless on Fridays I don't have surgery. So I'll paint from 6 to 7, paint for an hour. And then, my wife's out of town right now. So I'm going to paint a little bit more. So at night sometimes. So I'll, whenever I can squeeze in an hour, I'll do it.
So you balance a lot. How often, you said you teach a class. How often do you teach?
So I run one course a year in St. Louis. I've been doing it for 16 years now. It's really a beginner course, and I'm very proud of it. I think it's really a premier course. Actually, hey, I've got to read this. I'll look this up for a second. Oh, I just turned off my phone. But I got to read this. It's really cool. But anyways, I'm running Berlin, which is the International Society for Hair Restoration Surgery meeting coming up in October. So welcome any hair surgeons listening to this podcast to come there.
Mm-hmm. Yeah, and he runs a great course, whether it's whatever level, it's very good.
Mm-hmm. It's just so funny how far it's come, because you see the funny, like in the shows that we'll watch, like about Magic Johnson or about the Lakers, they're all the funny old hair transplants, all the fakey, not just the swoop overs, but just and it's so real now. It looks so natural.
Well, and I would say the trend for men is to do several smaller transplants and have a more
natural progression,
kind of like cosmetic surgery just in general, but instead of having a massive big day, doing several small.
Well, the cool thing about that is, like, I've got someone that we go to school with that I've watched, and it's happened so slowly. I'm just like, did he lose weight? Did he do something different?
Exactly.
Do you know what I mean? So, like, it's this natural progression. And I think you're right.
So for me, the size doesn't really bother me about the size of the transplant, because every single video, if you look at my close-up comb through video, I just shot one this morning. I asked them, did anyone notice? And the answer is no. I could take a man totally bald and put hair on their head, and no one notices for two reasons. One is it follows all the rules of naturalness. And the second reason is that it slowly grows in. And so when it slowly grows in, people don't perceive it. They can't perceive it. So I don't mind doing a slightly bigger procedure, and I don't think people will really even notice it. I wanted to read this. Is really inspirational. This is someone, one of my chairs, who was training a doctor, and she wrote me this. She wrote, "My dear Sam, this week I had a visit from a very young doctor from Brazil. He was a St. Louis student 2 years ago and asked to come to Guatemala, where she practices. He found your course after contacting ISHRS, and he told me that St. Louis was a butterfly effect in his life. He had just graduated medicine. He was 24 and went to St. Louis. He joined later the ISHRS, being probably the youngest full member and also the youngest faculty. He is now a general surgery resident, and he is inspired by you to become a facial plastic surgeon. He has you on a pedestal, as many of us do, but his energy and surgical curiosity and ambition is truly inspiring. He will be in Berlin, as far as I know. He also sent abstracts. He will go far in his career, in this life, in this career. Just want to let you know, there are many lives touched and changed by your course. I feel privileged to be part of it." So I thought that was very moving for me.
Pretty high compliment, huh?
I never know what lives you affect,
No.
Yeah, just going past your own practice into the future, which is so amazing. Yeah, that's special.
Well, and again, that's a lot of that is not just your knowledge, but your organization. Like, a good teacher explains things in a way that makes sense, which hence all the books, hence the teacher.
Mm-hmm. And always available if you ever have a question about a case or any problem or situation that you have, or just an approach to something. Sam's always been very
only for Hannah, though. No,
only for Hannah. Only if you like the person.
No, it's been great. I just want to I want to make sure that we touched on everything new in the regenerative medicine space. You're still doing PRP, but you just feel like people.
I'm doing a different method of it. And actually, again, to put a plug in for Berlin coming up, man, about a third of the podium time is on all the new technology that's regenerative medicine. They're really amazing, the stuff that's coming around. There's so many new machines, there's so many new therapies. It's pretty incredible. And like one of the one that's probably on the horizon in about 3 to 4 years is PP405. I don't know if you heard about that from LA. They're on phase 2 clinical trials now. That could be very interesting, trying to reawaken the stem cells that are dormant in the hair follicles. There are a lot of interesting things from stem cells, I don't know. There's an infinite number of things that are out there that are coming around the corner.
Can you tell just briefly about PRP and why you don't love it?
I find the PRP for me is very uncomfortable. People don't like things that are uncomfortable. It can cause some hair shedding. And I don't think the growth factors are consistent enough to get the results in my hands. I've tried different ones, different therapies with A-cell. I stopped using A-cell.
I used A-cell for a while too. Mm-hmm.
Yeah, I not to scare you guys, but I'm a reviewer for about 5 or 6 journals, and I came across this one thing that said, "Oh, this can cause blindness." I'm like, "Okay, I'm done with this one." So as soon as the embargo was lifted, I got this into the literature for the ISHRS so that people would not be using this. But I've never had that, obviously, fortunately, but still. So it's not that it's bad. I think PRP is still good. I think there are many ways to do things,
And just to reiterate for people that PRP is where you take part of your blood. So there is a blood draw component to it. And then we process the blood and we inject growth factors back in. So there's an injection getting the blood, and then there's injections placing it near the hair follicles. So that's what.
And I use PRP actually with every surgery still. So I'm not against PRP.
It's just a practical matter in some ways.
What about we always have to ask this because we're girls,
sure.
Menopause connection to this. I know that, we've interviewed Dr. Heidi Flagg about, the hormones and things, but I know that this is hair loss, hair thinning is a big part of. Do you see a lot of women that come in with this that?
Absolutely. And so really what it is I really am a big proponent of HRT, hormone replacement therapy, for those that would benefit from it. I simply tell my patients, look, I'm not an expert at this. I'm not going to tell you should be on it, shouldn't be on it. But if it's causing hair loss and you've got other side effects that are an issue, you may want to consider investigating that besides my just doing a transplant for you, instead of my just throwing finasteride at you or a topical therapy or whatever it may be. So fundamentally, if there is a hormonal change, to consider looking at a big picture. But at the same time, if let's say they've had menopause for 5 or 10 years, or if it's a slow progression of hair loss, doing hormonal therapy is not going to bring all that hair back. A transplant is a pretty easy ticket to improve that situation for them. So I think it's a case-by-case situation, and one that requires collaboration with specialists.
Yeah. Mm-hmm. Yeah. So just to review, if you did have a menopausal or postmenopausal woman coming in, you would put them on the natural topicals that we discussed, and then, encourage to have them be evaluated by their OBGYN, and then any other medical therapy that you would do at that point?
Again, only if they have a testosterone imbalance, that's very clearly even in the labs, like if they're what's called dihydroepiandrosterone sulfate, DHEAS for short, which is the major male and female androgen that's in the body. If they look like a testosterone imbalance, then I would probably put them on a finasteride, as I mentioned. But otherwise, I really allow the hormonal therapies to be in the purview.
So there's not multiple people, working on the hormones.
Yeah, I'm not going to manage the hormones, but if they have, as I mentioned, a chronic slow hair loss, then a transplant's an easy target for them.
We like this little thing. I'm sure you see it all the time online, where we ask you some questions, and you can either for this one, like truth or myth.
Sure.
Do this.
I'll do it.
No, you go ahead, because I know the answer to some of these. So you can.
Well, I know, but that's okay. All right. So
you should know the answers to all of them, Hannah.
I do not. So I'm the one to ask. Okay. We're going to throw out some common beliefs, and you tell us if they're truth or myth.
Okay. Go for it.
Number 1, hair transplants are just for men.
False. I think we've established that.
If you wear hats too much, you'll go bald.
False.
supplements can grow back hair loss.
Absolutely. I was 30 pounds heavier about 15 years ago. My crown was thinning, and I lost the weight, and my hair grew back.
Really? What kind of supplements? Now we're here to talk about that.
Honestly, I'll take me about 30 minutes to tell you all the supplements.
Okay, so you have a ton. I take a ton of supplements.
But to be very honest with you, I just lost the weight and my hair grew back. So
that's so interesting. So that is a factor.
Yeah.
There's so many factors with hair.
Wow. I would never have guessed
in
that.
women, especially too. And that's what makes it so complicated. You know,
I had no idea that. And like I said, okay. Number 4, PRP works for everyone.
I mean, it does and it doesn't, as I established. I think it's not a bad technology. I think there are just better ones out there today.
Okay. Once your follicles die, they're gone forever.
Sort of. I mean, they when you look at a bald head, there's the follicle still underneath the scalp. When it's slick bald, the odds of it coming back with medical therapy are very low. But I have seen some shocking things where I think there's no way medicine can work, and it does.
Very good.
I just like to go back to the medications too. I don't know how biotin got so popular in the lay community for hair.
It did. It is.
About 100% of my patients seem to be on it. And I have so many problems with bruising and bleeding with biotin and things when biotin is in multivites or other vitamins patients are taking, they don't even know.
Right.
And when we suss down and stop it, it really helps so much with their other procedures. I don't really know when biotin started, when people started.
The only thing I can say is that the statistical evidence for biotin only shows significant improvement in those with bariatric surgery that have a vitamin deficiency. So I have a little bit of biotin in my product, but I also sell to bariatric surgeons. So it's a very topically, but it can help with balancing you if you've had like gastric bypass.
And I would think that a topical biotin wouldn't be as problematic as oral.
Right.
Yeah. I mean, I think that was so great. I think the main take home is really the change in the craft of the procedure. It's not the same as other facial plastic surgeries. It's very, very different. And it really is affected by the experience, the care, the ethics of the surgeon. And it's really, really important to find somebody, going by price is just a huge mistake in this arena.
I think just one take-home lesson is if you're meeting with a salesman, that's a red flag. If you feel like they're trying to get pressured into closing a deal and they have not done a physical exam on you, not taken a history, not evaluate your hair, have no clue what they're doing, and they're throwing you, here's a 3,000 graft case, run away. Okay. You need to meet with a physician at some point. Maybe some of these larger clinics, they don't have a surgeon there. But if you're not meeting the surgeon until the day of the surgery, perhaps or never, that's really, really dangerous.
Well, I feel like you have, when you're explaining yourself, there's criteria. Like I ask about men and you say young men this. So obviously that's of the utmost importance.
Yeah.
And it does frame like you said, it's my sister went to makeup school. And one thing they said is if you could take one makeup tool with you on a desert island, it would be eyebrow, an eye pencil because it frames your face. So I always think of that when you're talking about, not only the hairline, but the brows. So, and I didn't know you could get those. So Thank you so much for all of your wonderful information. I'm sad I can't go to Berlin, but I'm not a doctor. So
maybe one day.
I'll just have Hannah tell me all about it.
Have you ever considered, I'm sure you video all your lectures, putting that up for somebody who wouldn't make it to Berlin to be able to.
Funny you asked that. So I actually shot a master course, for QMP, Quality Medical Publishing. By the way, all my textbook and courses are donated to charity, so I don't make any money on those, so I have no disclosures on that. But basically, what I did was in 2023, I did two things. One is I created the Hair Transplant 101 book for beginners for Quality Medical Publishing. And then with Marina Medical, I had 4 people do an entire, so I think St. Louis, the course I run is amazing, but it's not all my voice. Some people want to hear everything from my voice. So I shot an entire day of lectures, all day of lab interaction with my students who are all filmed by Marina Medical. You can get both of them on qmp.com. And hopefully it helps people.
Berlin won't be available, but these other specialties.
So Berlin is actually available virtually. Yes, I'm sorry.
Okay,
I apologize. I'm not lecturing in Berlin.
Okay.
I have some videos that are being there. I don't have time to lecture. I'm focused on running the whole meeting.
Is it a synchronous virtual experience or
No,
asynchronous?
it's not. It's asynchronous. You'll get it about 2 or 3 months later. But you got to go. For those that are hair surgeons listening, you got to go to Berlin. You're going to. I will make you very sad for not being there.
I know it sounds really, really special.
Yeah.
Mm-hmm. Great.
Well, thank you so much for your time today, Dr. Lamb. We sure appreciate it. It was very interesting.
Okay, well, thank you so much, Dr. Lamb, for all of your insights and helping to give us a background of hair loss and hair transplants and what's new, and just really showing how this surgery has changed over the last several decades, and it's really turned into more of a craft, and that we take it very seriously, and some of us live and breathe transplants and how we can make the hairlines more natural appearing. And we just so appreciate you coming on.
And for anyone that's listening who's facing hair loss, you're not alone. There are real science-backed options out there that can help. Whether it's regenerative medicine or advanced surgery, this is a field evolving very quickly. Especially for someone like me that didn't know all this, I did not know all the different options for females, the eyebrows, the difficulty of mimicking the correct hairline, and how much better of a job they can do now than the yucky old flap over plugs of the olden days. So I think this is a great thing for people to learn about.
People are afraid of transplants because of that history, but it's really one of the surgeries that's come the longest way in my lifetime. And so it's really exciting, all the future
Very
therapies.
exciting. I hope people can tune in, and if you have questions about it, they can look and see.
Glad we had Dr. Lamb on.
Thank you,
Let's
Dr.
Face
Lamb.
It. And we look forward to our next podcast.
Be sure to subscribe and share this episode with your friends, especially someone that's out there struggling with hair thinning or hair loss. It could be a huge help to them. Thanks for tuning in.